If help is on the way, the next 3 minutes can decide how much damage your body takes, and most seniors lose those minutes by doing the exact wrong things. If you want to stay healthy and independent as you age, hit that subscribe button right now. We share simple, science-backed health tips like this every single day. Look, I have seen the same pattern again and again. A senior feels chest pressure, sudden weakness, a bad fall, or crushing shortness of breath. Help gets called. But then panic takes over. They keep walking. They start searching for papers. They call family first. They lock themselves behind a door. And those small mistakes steal precious time. Today, I want to give you one simple routine you can use before help arrives. It takes about 3 minutes, and it can make those minutes safer, calmer, and more useful for you. Now, before we continue, tell me your age and where you're watching from in the comments. This helps us understand who we're helping. Here's what most people get wrong. They think the emergency starts when the ambulance pulls up. It doesn't. It starts the second your body sends the warning sign. That is when the clock begins. And that is when your choices matter most. A lot of seniors believe they should wait 5 minutes and see if it passes. Others think they should call a son, a daughter, or a neighbor before calling 911. Some even think they should drive themselves. That sounds reasonable, right? But in real life, that delay can cost you treatment time. A 2024 study led by researchers from the University of Michigan and Brown University found that stroke patients who arrived later also missed faster care. And Black patients in that study arrived about 28 minutes later and were about 20% less likely to get EMS hospital pre-notification. In simple words, when emergency teams know what is coming, the hospital can move sooner. That matters more than most people realize. Source. And there's another myth. People think panic breathing helps. It doesn't. Fast, shallow breathing can make you feel even worse. It can make dizziness, tingling, and fear spiral. Your body starts acting like a car engine that keeps revving higher and higher. What you need is not more panic. You need control. There's also confusion about aspirin. Some people think it is always smart. Others think it is always dangerous. The truth is in the middle. A 2024 study from Harvard T.H. Chan School of Public Health found that if adults with severe chest pain took aspirin within 4 hours, more than 13,000 heart attack deaths a year could be delayed in the United States. But that same research also makes one thing very clear. Aspirin is not for every emergency, and bleeding risk is real. We will talk about that in a minute. So what should you actually do? Not 10 things, not 20 things, just this simple routine. Number 5. Call first, explain second. Most people think they need a full story before they call, but actually the first 10 seconds matter most. This is not the time for a long speech. This is the time for clear words. Say your address first, then your age, then the main symptom. Keep it plain. I am 74, I have sudden chest pressure. Or, I am 81, my face feels droopy and my arm is weak. Or, I fell and I cannot stand. Or, I cannot catch my breath. Why does this work so well? Because dispatchers listen for danger words: chest pain, stroke signs, trouble breathing, fall with injury, fainting, confusion. Those words move things faster than a long, worried explanation. Think of the dispatcher like an air traffic controller. They do not need your life story first. They need the exact signal that tells them where to send the plane. Here's the thing. Do not say, "I think I'm bothering you." Do not say, "It's probably nothing." And please do not start with, "I'm sorry." This is exactly what 911 is for. If you can, add one more line. Say whether the door is unlocked. Say whether you are alone. Say if you are on oxygen, insulin, or blood thinners. Those details help. And if you are speaking for a spouse, keep it just as simple. My husband is 78. He has sudden slurred speech. Last normal was 10 minutes ago. That last part matters. Last normal means the last time they seemed okay. Practice this now while you are calm. Really, could you say your address and symptom in one breath? If not, you should rehearse it today. But wait until you see number 4. Number 4, sit down and stop moving. Most people think they should walk it off, but actually moving around can make things worse. If it is chest pain, your heart may already be struggling. If it is shortness of breath, walking can push your body harder. If it is a bad fall, trying to stand can turn a small injury into a bigger one. A 2024 Mayo Clinic study found that older adults marked as high fall risk in the emergency department had a 30-day death rate of 11.8%, compared with 3.1% for lower risk patients. That tells you something important. Falls are not small events in older age. They can be a red flag for bigger trouble. So what is the safest position? It depends on the symptom. If you have chest pressure or trouble breathing, sit upright. Use a firm chair or sit on the bed with pillows behind you. Keep both feet flat if you can. Loosen tight clothing. Do not pace. Do not bend over. If you feel faint, cold, or sweaty and breathing is okay, lie flat on your back. If it does not hurt, raise your legs a little with a pillow. If you have stroke signs like a droopy face, weak arm, or slurred speech, sit or lie on your side with your head slightly raised. Do not eat, do not drink, do not take random pills. If you fell and hit your head, back, or hip, do not try to be strong and stand up. Stay still. Cover yourself with a blanket if you are cold. Wait for trained help. Let me be clear, pride is dangerous in an emergency. This is not the moment to prove you can still manage alone. Quick question, have you ever had sudden chest pressure, dizziness, weakness, or a fall that scared you? Comment yes or no below. Now let's go to number 3, because this is where most panic starts. Number 3, slow your breathing before panic takes the wheel. Most people think taking big, fast breaths helps, but actually panic breathing can make you feel more dizzy, more shaky, and more afraid. It is like throwing gasoline on a small kitchen fire. A 2023 study from Stanford Medicine found that just 5 minutes a day of controlled breathing reduced anxiety and improved mood. And the breathing groups did better than simple mindfulness, with about 1/3 greater improvement in positive feelings. The exhale-focused method worked best. Source. Now, this is not a cure. It will not stop a stroke. It will not open a blocked artery. But it can stop panic from making the emergency worse. Here is the simple version. Breathe in through your nose for 4 seconds, then breathe out slowly for 6 seconds. If that feels too long, do 3 in and 5 out. The key is this: your exhale should be longer than your inhale. Why? Because the long exhale tells your body, slow down. It is like taking your foot off the gas pedal. Your heart may not instantly calm, but your body often stops climbing into full panic. Do 5 rounds that takes less than a minute, then pause. Do not force giant breaths. Gentle breaths are better. If one method makes you feel worse, stop and return to normal breathing. If you are helping someone else, breathe with them. Count out loud. In, 2, 3, 4, out, 2, 3, 4, 5, 6. Your calm can help steady their fear. And please remember this: if breathing is getting harder, lips are turning blue, or the person cannot speak full sentences, do not waste time on any technique. Keep the line open. Help is needed now. Before we go further, if this is making sense so far, hit that like button. It tells me you want more videos like this. Now here comes number 2, and this one is so simple that many people skip it. Number 2, open the path and gather the essentials. Most people think the first job is finding the insurance card, but actually, the first job is making it easy for help to reach you. Unlock the front door. If it is night, turn on the porch light. If you have pets, put them in another room if you safely can. Move a walker, rug, shoe, or small table out of the way. Put your phone on speaker. Stay where you are. Then gather 4 things within arm's reach: your medication list, your allergy list, your ID, and your phone charger. Do you see why this matters? Emergency care is often delayed by small confusion. What meds do you take? Are you on blood thinners? Are you allergic to anything? When did symptoms start? If you cannot answer clearly, that list speaks for you. A 2024 study from the University of North Carolina found that high-risk medications were identified in 53.7% of older adults who came to the emergency department after a fall. In other words, more than half had medicines that could complicate what happened next. That is why your medication list is not a small detail. It is a safety tool. Source. Keep the list simple. Write the drug name, dose, and when you take it. Include over-the-counter pills too. Include aspirin, sleep aids, herbs, and vitamins. Those count. And one more thing. If you wear hearing aids or dentures, keep them in if possible. That can help you hear and speak more clearly when responders arrive. But wait until you hear number 1, because this is the step people misunderstand the most. Number 1, know the aspirin rule. Most people think aspirin is harmless, but actually, aspirin is helpful only in certain emergencies and risky in others. Here is the simple rule. Aspirin may help if you have severe chest pressure that feels like possible heart attack, and you have already been told by your doctor that aspirin is safe for you, or the 911 dispatcher tells you to take it. In that situation, the usual emergency amount is 1 regular adult aspirin, which is 325 milligrams, or 4 baby aspirins, which add up to 324 milligrams. Chew it. Do not just swallow it whole. Chewing helps it work faster. A 2024 Harvard-led study estimated that taking aspirin within 4 hours of severe chest pain could delay 13,016 heart attack deaths each year in the United States, even after accounting for bleeding risks. That is powerful. But it comes with a big warning. Source: do not take aspirin for stroke warning signs unless a medical professional tells you to. Why? Because some strokes are caused by bleeding, and aspirin can make bleeding worse. Do not take aspirin if you have an aspirin allergy, active stomach bleeding, vomit that looks like coffee grounds, black stools, or if a doctor has told you never to take it. And be extra careful if you are on blood thinners like warfarin, apixaban, rivaroxaban, or dabigatran. In that case, wait for direct medical guidance. This is why I call it the aspirin rule, not the aspirin reflex. Not everyone should reach for it, but everyone should know when it might matter. I'd love to hear your story. What made you click on this video today? Share in the comments. Now let's pump the brakes for a second. I'm not saying this to scare you, but you need to know where this routine stops. This routine is not a replacement for emergency care. It is not a home treatment plan. It is not a test to see if you can avoid the hospital. If you have chest pain that lasts more than a few minutes, sudden one-sided weakness, new confusion, sudden trouble speaking, severe shortness of breath, blue lips, a bad fall with head injury, or you pass out, call 911. Not later, now. And if symptoms improve after a few minutes, that does not mean you are safe. A warning spell can come and go. A mini stroke can fade. A heart problem can ease, then crash. Do not let a quiet moment fool you. Also, do not eat or drink while waiting if there is any chance of stroke, choking, or serious breathing trouble. Swallowing may not be safe. Do not take random pain pills. Do not use a heating pad on chest pain. Do not get in a hot shower. And please do not try to drive yourself. So you're convinced, but thinking, how do I actually do this? Make it easy. Today, write your address in large print near the phone. Put a medication list in your wallet and on the fridge. If your doctor says aspirin is safe for you in a possible heart attack, keep an unexpired bottle where you can reach it. If not, do not keep it as a guess. Ask first. Then practice the breathing part once a day, just 1 minute. 4 seconds in, 6 seconds out. That way, in a real emergency, your body already knows the drill. If money is tight, do not overcomplicate this. You do not need special gadgets. A notebook page works for your medication list. A cheap folder by the door works for your ID and allergy list. A flashlight from the dollar store helps at night. A simple chair with firm back support can be your emergency seat. And if you live alone, tell one trusted person where your list is kept. Not tomorrow, today. Look, there's a lot of noise out there. Too many fancy tricks, too many scary headlines, too many people making emergencies sound mysterious. They are not mysterious. They are time sensitive. You do not need to overthink this. Start with just one action step. Make your emergency list today. Then practice saying your address and symptom out loud. Then rehearse the routine. Call, sit, breathe, open, prepare. Your body will tell you if it's working. Panic will come down. Your words will get clearer. Help will reach you faster. and that can make a very real difference. If this helped you, hit that like button, and if you want more videos like this, make sure you're subscribed because we post new health tips every single day. Stay healthy, stay strong.